Today it was really exciting and it was really buzzy. We had about 50 people here to share some stories from the book that has been published recently. There's five presentations from various people talking about their chapters, what their experience about co-production is, how it's important to redesign your services around that co-production ethos. Today I've been talking about our website My Care My Choice, which was co-produced with customers, stakeholders about 4 years ago, and we wanted today to share our experience with partners and colleagues, share a bit more about the chapter of the book, about the impact it's had locally on how we've redesigned our services and information systems on the back of using My Care My Choice website as our vehicle to promote choice and control.
So why did you have to redesign My Care My Choice?
Because our previous website was so difficult to understand and navigate that people spent up to 45 minutes trying to find basic information about social care. We knew that it wasn't working for a lot of people, so basically we work with customers who are the end users of our information resource to basically redesign the way that they want information to be presented in a sort of accessible, bright, colourful way, which isn't about social care being the place of last resort, which was what it was perceived of by many people that we work with. We used a technique called ethnography, which I hadn't come across before, but basically ethnography is called stepping in people's shoes. So basically where you work with a customer around how they want to receive information, what matters to them. We might think that they want to read policy documents, most people don't. They'd rather get to information within 2 or 3 clicks about what they need for their support. Their mother is isolated, how can we support that in terms of interventions? Where can people be signposted to? That's what matters to people, not reading carers' strategy documents, unfortunately. So that's kind of where we moved from, and that's why we did it.
What is the new design like?
It's colourful. You can see it on mycaremychoice.org. Hopefully I've got the web address right, but we'll put that on anyway. There'll be a link hopefully on this blog so people can see that. But basically, it's bright, it's colourful, it's positive imagery, it's quite quirky imagery, which was challenging for us in terms of some of the pictures on there. So we've written it in plain English so people can read it and access it, and hopefully people can get to the information they want within 3 or 4 steps.
And what kind of results have you had since that redesign?
Basically, we've seen a real use of the website as a primary resource for customers, but also for our staff, our partners in the voluntary sector use it as a resource to talk to people. With over about 450 pages on there now, it's a real rich resource that we keep maintained and up to date, and that everybody has a stake in keeping sort of fresh and new because everybody owns it in Stockport. Certainly we know that people are getting better quality information at the time they need it. We've made some estimates around the efficiencies around social work time and contact centre time. We roughly estimated we would be saving about £200 to £300,000 a year on what we are calling not failed assessments, people ringing us when they didn't need to, where they can do self-service now. So as I say, the other big thing is that it is a much better customer experience and much more positive experience around social care, we hope. So the cost benefit, there's financial benefits, but also customer experience benefits as well. And co-production means very different things in different settings, and what we've learnt is it's not a one-size-fits-all. It's a model. It isn't a sort of you buy your ticket or you buy a book and you can do co-production. It's about what best fits in each of the areas that we've talked about today. And there's been a lot of buzz. We've had really good feedback from people who've been here about it. Food for thought. The best 2 hours somebody's spent in a long time. And I'm really pleased that Stockport hosted this and has got real benefits out of it in terms of networking with people and having a really lively debate today.